a family member, and we ask you to please ask those questions on here. If you comment or ask a question while we're live, your name will go into a drawing and we will contact you and send that over to you. We'll have a little prize for you. So Natika is going to go over a few things. She's going to go over our visitor policy, some different COVID protocols that you'll want to know about, and what are just some resources available to you as new moms or moms that are, have been here for a while but just don't know what to expect right now during this time. So we are live. We're going to be kind of moving around the room a little bit, so please be patient with us. But thank you again for joining us, and we're going to go ahead and have Natika come on. I'm going to put my mask back on, and then she will join us. Hello everybody, I'm going to take my mask off. As Ashley mentioned, I'm the director of Women's Health, but some of you may have also seen me through drive-through testing recently that we're doing at the Rodeo Fairgrounds Monday, Tuesday, and Thursdays. So there's a lot of concern and caution around COVID, but we're still here to take care of patients just as we always have been. We have a very skilled nursing department, we have very skilled physicians and pediatric providers that are here and ready to take care of you and everybody in our community. Our nurses specifically are taking precautions. Everyone is wearing a mask, and we will start wearing goggles with all patients. We're following CDC recommendations for safety precautions when we have patients come in. Our visitor policy right now is that we are allowing one birth partner in our department, and that kind of alludes to some of the things that have been coming up more recently. If we have a positive birth partner, what would we do? And we're actually in talks about how we might handle that, and so we're going to be releasing more information to the public and to our patients in the coming future. When we have a patient arrive to our department and they're here for triage, if you're symptomatic, then we would ask you to come into a room that has negative pressure, and we would test you for COVID upon arrival. If you arrive for a triage, you're not quite sure if you're in labor, or maybe you have another issue with your pregnancy, we would take you to another room, and if you don't have symptoms, we would not test you for COVID at that time. If you then became a patient, we would do a COVID test for you. We're also offering that to your birth partner, and the birth partner is free of charge. We're able to get those results fairly quickly as the test is done in-house in our own laboratory. So we're able to get those results back within an hour to help you know what your COVID status is at the time of admission. It does help put you at ease, I would imagine. And we also have opportunities to keep you and your baby and your family safe. CDC recommends that if we have a COVID positive mom, that mom and baby would be separated. That is not necessarily the final say on it. CDC does also have recommendations if mom and family decide to stay in the same room. And we're ready to do either. So if mom is not feeling well and very, very ill and needs to focus on her own recovery and wants baby to come out of the room, we're prepared to do that. But we also have the opportunity to keep you together so you're never separated. We have an opportunity to keep your baby in the room with this isolette. It's actually plugged in, so Ashley's going to bring it over for us in just a second. An isolette is used in a lot of cases, most of the time for critically ill infants, but because of the nature of what this looks like, it helps keep droplets off of your neonate, your baby, your infant. And I'm going to bring this into the picture. We were lucky enough to have a donor donate the funds for this isolette. So we're able to keep your baby in here, in the room with you, to maintain 6 feet of distance. We also will go over with you hand hygiene if you're breastfeeding, hygiene with your birth partner, to keep you and your baby as safe as possible. I think that's been one of the biggest concerns and the biggest questions in our community is my baby going to be taken away from me if I'm COVID positive? And that's absolutely not our recommendation, nor do we support that. If that is what you want because you're not well enough or your birth partner is not well enough to help you, we can make other accommodations. Right now, we have two negative pressure rooms. So the negative pressure means that there's a HEPA filter that is attached to a window apparatus, and it helps pull all of the air out of the room and out the window instead of pushing it out into the hallway. So that not only keeps you safe and our staff safe, but other patients as well. So we're able to care for you in this room, and as a couplet, we call it couplet care, and keep you together and discharge you together as long as you're still continuing to be healthy and your baby's continuing to be healthy. The other things that we are doing to help keep everybody safe is if you are COVID positive, we would have more what we call PPE, personal protective equipment on. Besides a mask and goggles, we would have a gown on. We would actually have a special N95 mask on. The mask that I was wearing at the beginning of this is a cloth mask. And because I'm not always doing direct patient care, that's what I wear when I'm interacting with my colleagues or staff. If I'm going in to take care of patients or help out with patient care, I will change into what would be appropriate for that patient. We, trying to think if there's anything else on that list that I provided to you, Ashley. Were there any questions at all?
Are you seeing any, COVID issues with babies or?
So right now, we've not had a single mom come in or birth partner and test positive for COVID upon arrival. The physicians are letting me know that we have had some people within their practices that have started to test positive, and so we're preparing and we have an operational plan for if that does happen, what we're going to do. And I just kind of alluded and spoke about keeping everybody together as much as possible, and how we might also need to co-manage with med-surg with our hospitalists, our intensive care providers, if mom isn't feeling well, and alter our care a little bit there. So we do expect that we're going to see people that have experienced symptoms, but we haven't had anybody yet. And none of the nurses in the OB department have tested positive for COVID yet either. They were all taking precautions and trying to keep their social distance as much as possible, limiting their contacts, making sure that they're safe when they're here at work, and keeping their own families safe too.
Awesome. And maybe just resources that we have.
Okay. And some of the resources that we do have available within the department, especially for what our normal care would look like, we have a lot of certified lactation consultants. So they're able to, counselors, they're able to help you with breastfeeding. And we have a really close relationship with the public health department. And the one really unique thing about Wyoming is that all patients are allowed to have a home visit or have home visits from the public health department, regardless of their insurance status. That's not afforded to every mom in every state. So I'm really proud of Wyoming for stepping up and helping out some of our more vulnerable populations in a time where it's sometimes hard to ask for help because you feel like you should know it all, and that's absolutely not the case. It's the time when there's so many questions that pop up and so many unique situations, and you may not have that resource available within your own circle of friends or family. So we want to make sure that you know that we're here and available, but we also have resources outside of the organization within Park County to help you. We also have prenatal classes that we started back up fairly recently. So we are doing in-person classes. We are asking that all people wear a mask when they show up, and our instructor for the day will be wearing a mask as well. Those sessions are taught by an individual that has expertise in that field, and we do have a few guest visitors from time to time, just depending on their availability and what might be happening at the time. So You can register for our prenatal classes on our main hospital website, and if you have any problems with that, you can always call the OB department and ask for help and assistance in getting registered for that. And our number for the OB department is 578-2210. Again, 578-2210. We get a lot of questions from time to time about pregnancy. We get a lot of questions from time to time about after the baby's born and some normalcy. We can usually answer questions. The nurses can usually answer questions until your baby turns about 30 days old. After that, some of the questions that you have may be more specific to pediatrician. And also when you call, we may still refer you to a pediatrician if the question that you have is a little more complicated than what we feel is appropriate to give you information on.
So when you're having a baby, are you allowed to go into the jacuzzi tub? Can you leave your room? Do you have to stay in your room?
So if you're COVID negative, you are able to leave the room and walk around in the hallways. We would ask that, if you are capable of wearing a mask in the hallways, we would ask that of you. We would ask that for sure of your birth partner. We're not asking patients to wear a mask during labor itself or when you're in your room. Our hot tub, we have a jacuzzi hot tub for all patients that are experiencing labors that can afford that, meaning if you are induced, you can still have a hot tub as part of your labor plan. As you get a little bit further along and maybe need an epidural, you wouldn't be able to get into hot tub at that time. But we do have epidural service for all our patients, and we have a lot of people that take our anesthesiologists up on that.
Okay. I think that's it.
And any questions at all?
No, that was it.
Okay. All right. Thank you everybody for watching.
Thank you, Natika.